Hello, and welcome. Today we're going to discuss a complex genetic condition called Turner syndrome, and specifically, the heart-related challenges it can present. We'll explore what Turner syndrome is, how it affects the heart, and what can be done to manage it. Understanding the cardiovascular aspects of Turner syndrome is crucial for improved health outcomes for individuals with this condition. Turner syndrome isn't caused by something someone did or didn't do. It arises from a chromosomal abnormality. Typically, females have two X chromosomes. In Turner syndrome, one X chromosome is either missing completely or is structurally altered. This genetic variation occurs randomly, usually during the formation of the egg or sperm, or early in fetal development. It's generally not inherited from the parents. The missing or altered X chromosome leads to a cascade of effects throughout the body, particularly affecting cardiovascular development. Several heart defects are more common in individuals with Turner syndrome. These include coarctation of the aorta, which is a narrowing of the aorta, the main artery carrying blood from the heart. Another common defect is bicuspid aortic valve, where the aortic valve only has two leaflets instead of the normal three. These structural abnormalities, along with possible hypertension, can put a strain on the heart and increase the risk of other cardiovascular complications. Turner syndrome affects approximately 1 in every 2,000 to 500 newborn girls worldwide. Because it's a genetic condition present from conception, its prevalence remains relatively consistent across different populations. Early diagnosis is important to manage heart defects. The heart-related signs and symptoms of Turner syndrome can vary depending on the specific heart defect present and its severity. Some individuals may have no noticeable symptoms, especially early on. However, others might experience high blood pressure, shortness of breath, chest pain, fatigue, or swelling in the hands and feet. In infants, a coarctation of the aorta can lead to poor feeding, rapid breathing, and a weak pulse in the legs. It's important to note that these symptoms can also be indicative of other conditions, so a proper diagnosis is essential. Diagnosing heart defects associated with Turner syndrome typically involves a combination of physical examination and various diagnostic tests. A doctor will listen to the heart for any unusual sounds, such as murmurs. An echocardiogram, which uses sound waves to create an image of the heart, is a key tool for identifying structural abnormalities like coarctation of the aorta or a bicuspid aortic valve. An electrocardiogram of ECG or EKG can assess the heart's electrical activity. MRI and CT scans may be used to evaluate the aorta in more detail. Karyotyping, a blood test to analyze chromosomes, confirms the diagnosis of Turner syndrome itself. While there aren't distinct types of heart disease specific to Turner syndrome, beyond the structural defects we've already discussed, the severity of these conditions can vary widely. For example, a coarctation of the aorta can be mild, requiring only monitoring, or severe, necessitating immediate intervention. Similarly, a bicuspid aortic valve may function normally for many years or lead to aortic stenosis or regurgitation, both requiring management. Treatment and management of heart defects in Turner syndrome depend on the specific problem and its severity. Coarctation of the aorta is often treated with surgery or a balloon angioplasty to widen the narrowed aorta. A bicuspid aortic valve may require valve repair or replacement if it becomes stenotic or leaky. Medications like ACE inhibitors or beta blockers can help manage high blood pressure. Regular monitoring by a cardiologist is essential to detect and address any emerging problems. Growth hormone therapy, often used to treat short stature in Turner syndrome, can also affect cardiovascular health and requires careful monitoring. Unfortunately, because Turner syndrome is a genetic condition, there is no way to prevent it from occurring. Genetic counseling is available for families who have a child with Turner syndrome and are considering having more children. This counseling can provide information about the risk of recurrence and available options. The prognosis for individuals with Turner syndrome and heart defects has improved significantly over the years due to advances in diagnosis and treatment. With early detection and appropriate management, many individuals can lead relatively normal and active lives. However, regular follow-up with a cardiologist is essential to monitor for potential complications and ensure ongoing cardiovascular health. Recent research has focused on understanding the long-term cardiovascular risks associated with Turner syndrome and developing more targeted therapies to address them. These include studies investigating the impact of growth hormone on cardiovascular structure and function, as well as research aimed at improving the outcomes of aortic valve disease in this population. Continued research holds promise for further enhancing the lives of individuals with Turner syndrome.